Centura Health St. Anthony North Hospital in Westminster, Colorado, celebration is in the air.
It's amazing. I'm glad he got better. I'm glad he gets to go to rehab. Sooner he'll be able to go home.
The medical provider's 500th patient to recover from COVID-19 is about to be discharged from the facility.
Days like this are why we do what we do. To be able to see someone be able to leave and know that they're going to have another day with their family.
His name is Jose Diaz.
So he's a 42-year-old male that came in with complaints of shortness of breath and the typical COVID signs of fatigue, fever. He was with us for over 30 days.
Nurses say Diaz was a fighter, but he had help, and not just from them. He's the first patient at the hospital to receive blood plasma from a recovered COVID-19 patient. Plasma containing antibodies that help immune systems fight back the disease.
We have done a fair amount of the plasma transfusions, and they have fared well.
At 103 temperature on a Friday afternoon.
That's over 39 degrees Celsius, and it was Maurice Lyons' introduction to the coronavirus. The surgeon at North Colorado Medical Center spent 5 days working with COVID-19 patients prior to being infected. He decided he'd donate his plasma once he recovered.
Some of the reports I've read have been, really quite good. Within 24 hours of being administered, people were doing better.
The U.S. Food and Drug Administration approved the use of convalescent plasma for severe cases of COVID-19 back in March, and doctors have been administering it for the past month and a half or so.
When we first started, demand was far exceeded supply.
Dr. Larry Dumont is with Vitala, the second largest blood collection provider in the U.S. He says the coronavirus spread has created more potential and now actual plasma donors. Supply, he believes, has more than caught up.
We think there's probably a lack of recognition by some of the providers in the hospital that they're able to order this product and use it.
Vitala has collected 3,300 doses so far nationally. Clinical trials on convalescent plasma are underway. There's evidence it's produced some dramatic results, but also sometimes none at all. Lyons has overcome his fear of needles to donate 3 times.
And if it can help somebody, it's certainly the thing to do. It poses no risk to the donor.
A lot of days we did not think that Jose would make it to the next shift.
His nurses say it's hard to know to what extent plasma helped this father of 9 survive.
I feel like that's the main reason he got better.
He's a success story.
We're glad to see this day. This is what we always hope for.
Hendrik Sabrandi, CGTN, Denver.